Thank you all for making time for another installment of Navigating the New Normal. I am sporting a very big smile on my face. We've had some interesting conversations to kind of kick us off, but it's always a good time. And I am really thrilled by the guests that we are going to have joining us to talk about some of the tools that have been developed in collaboration with UAB and MotionMobs around COVID safety. So I want to make sure I don't steal anybody's thunder, but I do want to just lift up the work that these individuals and these the respective organizations, what they do in the community. They really are at the forefront of what it means for Birmingham to level up and to lean in. And so I am super pleased that they're going to be joining us. Of course, have to give a shout out to Christina Smith and Rebecca Dobrinsky. They bring all of this stuff together. They put up with me and they help put this on. So thank you all for the work. And also to you all, everybody who is in the attendee list, thank you for making time. There are a lot of Zoom options that you all could be attending right now. So we always want to make sure that you all know how much we appreciate the fact that you are spending that time with us, and then especially around such an important topic as we're going to be uncovering today. As always, we upload these to our YouTube channel. You can find those at youtube.com/techbham. If you are not a member of Tech Birmingham, make sure that you sign up. You can actually start and complete the process yourself. Just go to the website, techbirmingham.com/members, if you want to kind of dive into the member tiers and better understand some of the value. And also, if you are already a member, there's still additional ways to engage, whether that's through our volunteer efforts, whether that's through helping us think through 2021. We have a lot that is on the docket. So we want to make sure that we are reaching you all where you're at and that we're delivering the value that you've come to expect from Tech Birmingham. So that said, I will pause briefly for Christina and Rebecca. It doesn't look like I have missed anything, any housekeeping items that we want to lift up around question and answers, or are we good to go?
So go ahead, if you have questions for any of the panelists, go ahead and throw them either in the chat box or the Q&A, and I will make sure that we send all of those questions over to Emily to help us moderate that, and she'll find some spaces in the conversation to address those, or of course at the end we always end with a Q&A. So again, chat and Q&A. All right, I will mute.
All right, thank you, Christina. You heard it there, people. We are about to go ahead and get started. Again, I really encourage you to lean into today's conversation. It is critically important and germane given what we are all facing as a society around COVID, and the fact that UAB has taken a leadership role in this. And just quickly, I want to recognize Curt Carver, the CIO of UAB, who is also a super engaged Tech Birmingham board member. Really appreciate his leadership. But to have UAB leading one of the first institutions, if not the first, I'll let them correct that, but to engage around the Google and Apple exposure notification protocol and develop the GuideSafe app in collaboration with MotionMobs around that framework. I think, again, it's really symbolic of Birmingham stepping up to the plate. And then, of course, the fact that MotionMobs developed this, again, a Birmingham company. It just speaks well to what it is that we are doing here in our ecosystem. And so with that said, I will go ahead and turn it over to Curt Carver of UAB.
Well, good morning or good afternoon, everyone. I'm going to be very brief and just set up what this is, and then Emily's going to follow me and show it to you graphically how all of this kind of works. As Dion said, this really started out of a desire to protect the members of the UAB community and then statewide. And if you'll go back with me ever so briefly to March, in March, we had initial conversations of how do we get ahead of this pandemic. And the thought was we need to start tracking symptoms. That's how we get ahead of this. And then those folks that are beginning to show symptoms that the CDC is recommending that we monitor, that we start to address that. And so we were approached by some, we being Chris Brown, the Vice President of Research, and myself, were approached by some researchers of should we do this? We were skeptical, but we were ultimately convinced. I then turned to the Chief Technology Officer at UAB, Brian Rivers, who's on the panel, and we rapidly spun up some servers to start supporting Health Check and do that. And like a lot of IT organizations, we then moved away. We had other things to deal with. And about a month later, a different researcher came back to us and said, we need to look at exposure notification. And that was Dr. Sue Feldman at that time. And so we re-engaged with the project. And when we re-engaged, we had a quick kind of market survey of what are the different types of apps out there, and what are the frameworks, and what are the things that are most important. And through that, two of the design principles that you're going to see Emily and others talk about is this idea of user convenience and of privacy and security. And we're going to focus on privacy and security during this kind of panel presentation. That led to then a telephone call with Apple and Google. Is a little bit rocky at first. They're like, hey, you know, we do all our work with Samford, and we're not even doing work with Samford on this. So why would we do work with you? And so I leveraged Dion Gordon's name, and I said, wait a minute now. We're doing all this work with Apple in Birmingham, and you're doing all this work with Apple at UAB, where we were in the process of opening a campus store, an Apple store here in Birmingham, the second one. And I think you just don't understand the Birmingham story, and you don't understand the UAB story. And 2 hours later, literally 2 hours later, they're like, you're going to be our first partner. And away we go on this. This was it was late April, this whirlwind development. And as we started this whirlwind development, we knew we needed to pull in an external partner. And so I talked with the CEO at MotionMobs, and I said, there's not a lot of money in this. In fact, there's no money in this. I'm just going to pull some money out of budget to try to make this happen. But this is for societal good. We need to do a project that saves lives. And that led to Taylor kicking in and saying, MotionMobs is all in. We're going to partner with UAB. We'll jointly develop this app. And that journey began of rapidly trying to deploy this. And so on August 17th, we published the app. We were the third state to publish the app. Our app has unique features that other states and other countries don't have to protect your privacy and security. And we continue to have conversations with that. And I'm going to finish up right now because I promised everybody I would only talk for like 5 minutes, and I think I'm at 3. But I'm going to finish up by saying if everybody in Alabama downloaded and used the app, we could save around 100,000 lives. There's some guesstimates and estimates and whatnot, but we could save 100,000 lives. And we need the technologists to step up and to be the leading advocates for this. So that's why it was so important. In fact, Dion and I talked about this, my goodness, May. I mean, really early in the process that we had to get the Tech Birmingham community involved in being advocates. And we're so appreciative of the opportunity today to kind of share this message. So with that, I'm going to be quiet, exit stage right, and turn it over to Emily to show us how this app works. And then we can get into some panel discussion questions very quickly.
Thank you, Curt. Well, hello, everybody. Thank you for joining us today. I'm going to go ahead and share my screen so that you can see my slides here. And here we go. Okay, so I wanted to go ahead and just do a quick overview of the GuideSafe exposure notification app for the chance that some of you may not be super familiar with it, to give you just a broad overview of what the technology does and how it functions. So the first thing that I want to run through is, what is exposure notification? It came out very early that Apple and Google were naming this framework exposure notification, and they somewhat deviated from the term contact tracing. And so the big thing to note here is that exposure notification is not the same thing as contact tracing. And so these two concepts work in tandem instead of exclusively. You don't remove the need for one by having the other in place. An exposure notification facilitates anonymous notifications of possible exposure based on range and time. So for Alabama's GuideSafe app, that is if the phone detects that you are within 6 feet for 15 minutes or more of somebody who is later diagnosed with COVID-19, you will get an anonymous notification that you have potentially been exposed to the disease. This is something that is powered by Bluetooth instead of GPS. And that was something that was foundational to Apple and Google's technology because it protects user data privacy. And there's really no need for users to have to give up their right to privacy by consenting to allowing every single movement to be tracked, to having to compare your locations with other users' locations. Really, the Bluetooth technology of, well, you've been within range of each other and your devices have detected each other, was all that the app needed in order to be able to facilitate these exposure notifications. Another key element of the app itself is that it requires explicit user consent for every action. And so it's not an app that's tied into your doctor's office or anything like that. The app has no way of knowing whether or not the user has been diagnosed with COVID-19 unless the user specifically goes in and says, yes, I'm acknowledging that I have been diagnosed with COVID-19. So how does this actually work? Apple and Google put together a fantastic graphic that shows how two devices can be within range of each other. And in this case, they've got two people sitting on opposite ends of a park bench. So you may feel like you're at a safe distance, but in reality, you may not actually be beyond that 6 feet guideline. And then they chat for a while. They don't know, one of them actually was starting to come down with COVID-19 when they had that conversation. And when those devices exchanged those randomized keys, they each saved a copy locally to those devices. And then when Bob, the individual in this scenario who later becomes diagnosed with COVID-19, later submits to the app, hey, I've been diagnosed, I should let everybody know. What it does is releases the set of keys that Bob's device has been distributing over the past 14 days through the cloud. And then Alice's device sees that list and says, oh, I've picked up one of those keys through my interactions in the past 14 days. And then Alice's phone displays a notification to alert her to her potential exposure. And so throughout this entire process, no personal information is exchanged between users of any kind. Alice has no idea that it was Bob who was the exposure risk. It could have been anybody that she came in contact with. It's only those randomized keys that match and go ahead and send that alert. This is all made possible by the underlying technology that Google and Apple put together. The Google Apple Exposure Notification Framework is sometimes called GAIN. And so when you hear us today talking about this technology and you hear us use the word GAIN, that's what we're referring to. It has publicly available API documentation and the standards that it adheres to. So for those of you who are tech-minded on the call and you want to check it out yourself, they make it very easy to explore and go digging into. So that's the Google link for it. Take note of it if you want to hop in there and go digging around to see what you can find. It's a very open system to let developers know how it functions and to make everybody feel comfortable with it. We've seen continuous updates to this framework and both the iOS and Android operating systems to make this easier for individuals to interact with. And that even includes the Exposure Notification Express update. This was something that I certainly saw a lot of news articles a couple weeks ago when this finally hit iOS and Android updates, in that there is now an additional functionality that allows for this API to still function in states that don't have a full-blown app like Alabama. And so while it still requires some development work on the public health authority, it does help adoption rates. And so this is something that will be able to benefit Alabama and other states moving forward as we continue to use technology to really to enable all of us to stay safer in this new world of COVID that we are living in. And so that's just a little bit of background about what this technology is built upon, how the GuideSafe app works. And now I want to dive into some specific questions. So the people that we have on our panel today directly contributed to the development of GuideSafe for Alabama. And so you have the state experts on how this app functions, how it keeps you safe, and how it protects your user data privacy while still protecting public health. And so I'm going to stop sharing my screen so that you all can see them do their thing. And I will start by kicking off some questions over to the team to start getting their insight. So Curt did a fantastic job of kind of kicking us off as to how UAB originally got involved in this process. And Curt, if you wanted to elaborate just a little bit, I'd like to hear a little bit more from you about how UAB really approached striking that balance between being a responsible employer and university while also providing a crucial asset that was available to the entire state and not just the UAB community.
Yeah, I think, thanks, Emily. It's one of these things where if you look at UAB, as Birmingham goes, UAB goes, as UAB goes, Birmingham goes. So we have a deep partnership with Birmingham. And I think the second component that guides UAB is this kind of desire to change the world, to make the world a better place. And so while we were looking not only at the exposure notification app, but the sentinel testing and bolus testing for around the state, we were looking at the symptom tracker. We noted that we had a pretty awesome Alabama Department of Public Health that was vastly overworked and lacked the resources. And so what we tried to do is what we always do, is try to step up, help out the entire state, build systems that supported that, and then convince partners like MotionMobs and Tech Birmingham and other companies to come in and partner with us so that we could have the best and the brightest minds associated with this. It's kind of funny that in MotionMobs, you have two Taylors, Taylor 1 and Taylor 2. And Taylor 1 told me Taylor 2's the smarter of the two. And so we put Taylor 2 on the project. And so the idea was to get the entire community involved. It's a pandemic. How can we get everyone involved? And then at the same time, as we're doing that, to start to look at what were the guiding principles? How do we build this so that it was acceptable to the culture here in Alabama that may be different than South Dakota or different than Maryland or different than California? And so how do we build things in such a way that we can drive adoption of this and then get everyone back to what we love to do, which is living in this beautiful state? And so how do we flatten that curve and get everybody back? And so that's what kind of guided this idea that we're not just going to work for UAB. We're going to work and try to protect Birmingham. We're going to work and try to protect the entire state. And we're going to bring in the best minds. I mean, one of and perhaps we can talk about this, one of the really cool calls was where we've got medical doctors at UAB, medical doctors at Apple and Google, and the CDC all interacting and talking about what's the best way to set up the parameters. Is it 6 feet, 15 minutes? Is that in a 24-hour period or multi-day period? Do we count the segment slices? How do we protect identity? So a lot of really wide open, transparent collaboration. And the cool part is everybody listened to everybody, and the best ideas rose to the top that could be included in this app.
Thank you. Yeah, that was great. And I think that's a fantastic transition to the next question that I have. So I want to start with the basic concept of this gain technology in that it completely separates the randomized keys from personally identifiable information, PII. And so I want to go ahead and open it up to the panel to talk about, well, why is that important? Like, we're in a time of a national pandemic, certainly public health is of interest. Why is it still crucial that we separate these randomized keys from PII?
Well, let me just, this is Brian Rivers, just throw a couple of things in there. I think that the key for this app to work for any state is that the public's got to be able to trust it. And there have been a number of conversations around what do big corporations do with my data? What do they do with my identity? So how do you get the populace to trust an app developed by Apple and Google who have access to your personal data to be able to protect itself? And I think that's why privacy was so key. And especially here in the United States, that's a very crucial issue. Are we going to abuse the data that we get? There are plenty of laws out there, HIPAA being one of them, that also require significant protections for any health-related information like the data that could be collected through apps like this. So it had to have a privacy-first method in order to have the kind of penetration and adoption that we wanted to see.
Absolutely. And I know that user data privacy is a core priority for our team at MotionMobs. So either Taylor or Matt, do one of you want to speak to a little bit as to how we take that user data privacy principle really into consideration as we build these user experiences?
Sure, yeah. Anyway, I'll build a little bit on what Brian said. In addition to sort of the corporate angle and kind of the public health, protect, HIPAA and everything, all the sort of privacy laws that we've got in place around here, there's also the concern for kind of a stigma of being the person that got known in the company as, oh, this was the person that, had the virus or something like that. And if you are not identifiable in any way, then there's less disincentive to participate in a program like this. And that, I think, is also another large, you're not sharing who you are with the, if by some unfortunate circumstance, somebody else got infected, they don't have to know who it was, and to be hopefully protected a little bit by this app. And you can still share the data and still participate and still try and protect the community as a whole while not having to worry about, the fear or the stigma that might come with, being that person in the end. As far as MotionMobs, we like to take privacy very seriously, in everything we build. We try to build securely. We build to the, to industry standards of security with our apps and try to protect user privacy and user information. We try to, one of the big questions with all of our projects is like, do we really need that information about the people using our app? And if the answer is no, then typically we'll recommend that maybe we don't collect that information, or maybe that information is not relevant to the project. But and we're always looking for ways to improve on our privacy standards and our privacy methods. But this was a great case for us to sort of act on that in a very significant way and focus on that very, very, very strongly with the work that we were doing, and build something that benefits the community as a whole as well.
Yeah, absolutely. And I think the point that you make about, do we really need that information? Is it going to make a difference whether or not we have that to the effectiveness or the goal of the application? Really speaks to the difference between, is this technology based on Bluetooth or is it based on GPS location? So of course, we all know at this point, gain technology uses Bluetooth. It doesn't use GPS. But in the early days of this technology, I realized we're still in the early days, but in the even earlier days, there was a lot of conversation around, well, can you get the accuracy that you want based on Bluetooth? Don't we need GPS location of each one of the users? What kind of concerns have you all seen throughout the development of the GuideSafe app in, okay, people may think that you need GPS, but here's how we're using Bluetooth instead in order to still be able to ensure the effectiveness of the app, even though it doesn't access GPS location.
So you don't really need to know where in the world you are for the exposure notifications. You just need to know how close you are to somebody else, right? So we don't really need your location. We don't need to know any of that. We just need to know how close I am to you, how close I am to Bob, you know, whoever. I know that, so I will address one thing in just a second, but so that's why Bluetooth instead of GPS. It goes back to that privacy concern of, do we really need this information? We don't need your location. We need to know how close you are to somebody else. Bluetooth is perfect for that. It's also much lower energy, so it's easier on the battery life of devices. Now, in the Android world, there has been some controversy about some people having to keep location on in order for the app to work. Some older devices in their settings link the Bluetooth with the GPS as far as enabling and disabling from an operating system level. That's an unfortunate side effect for some older devices, but it's being addressed in some of the newer versions of the gain technology, at least as much as they can, in that we can now tell if you're on a device that corresponds to. So if your device is what's called, is not a locationless Bluetooth, doesn't have support for locationless Bluetooth, then we know that now, and we can tell you, oh, hey, so you're gonna have to enable your location. We're not using your location. We never touch your location. We don't care about your location. We're just using the Bluetooth. But unfortunately, on your device, that the two are inextricably linked in the Android operating system. So that has been addressed in the newer versions of the library. But yeah, we use Bluetooth because we just need to know how close we are. We don't need to know where we are. So.
Exactly. So I realize that there's still some skepticism across the communities of, well, I mean, you say that it's safe, but how do I know that it's really safe? And so if one of you could share just briefly, is the guarantee that, oh no, we're not using GPS, just trust us. Is that something that's able to be decided on the developer level, or is that something that's decided by Apple and Google?
So that's one of the things that Apple and Google actually prohibit in the agreement to use the GAIN technology. The contract prohibits it, the API prohibits it. They do an application review when you submit your application to see if you're trying to do it. And if they do, they will reject your application. So as serious as UAB and Alabama is about privacy, Apple and Google are there as well. So there are many stages to prevent that kind of abuse that people are so worried about. And people can go read that. Apple's published a lot of that information out there as well. The code base that we base our framework on is open source. So the code is reviewable also. So plenty of checks and balances in there. I'm sure I missed a few.
Yeah, that's great. I mean, this has been a fantastic opportunity for UAB to build on top of some great principles that have already been put forward by Apple and Google. And I would simply throw out there to our attendees, if you see any apps that are COVID trackers of some kind and they are tracking your location, those are not GAIN technology. You can be absolutely assured that those are not using the GAIN technology. So proceed with caution on any of those. Download GuideSafe instead. So one of the security concerns that I saw arise kind of in the early stages was the question of, well, could the keys that are exchanged between devices, could they be intercepted? Could somebody extract any data from those? What were to happen if some of those keys were compromised? Can one or all of you speak a little bit to, well, what kind of data is associated with those keys, and how is that particular structure built in such a way to protect user data privacy?
Well, let me throw
I will
something in
call
to
on one
start.
of you. There we go.
Let me throw something in to start. I mean, for one, the way to maintain privacy from the beginning is to maintain anonymity, right? The app doesn't know who you are, never asks for any identifying information at the beginning of it, and the OS doesn't share that with the app. But the keys that you generate are intended to be shared publicly. Your app generates keys specific to you that are only meaningful to you. To everyone else, they're just numbers. And only when you get those back through the process of the exposure notification do you identify that these were my keys. So a random number shared publicly on the internet has no value to anyone but you, is the whole premise behind the privacy model. And that's the only elements that are really transmitted from your device. So intercepted is the intent of those numbers, right? They want anyone listening to be able to pick those up because they don't identify you. They just are numbers that are generated from the point in space that you are.
I'll also say that, turn that fan off, sorry. I'll also say that the keys that you share when you submit that you've gotten a positive diagnosis are different from the keys that you're constantly transmitting. So just because they've intercepted those keys doesn't mean that they can like go submit those keys as, oh, this person was positive and let's just wreak havoc. That's not how it works. Like he was saying, the keys aren't linked to any personally identifiable data. Your device is the only device that knows those individual keys. Then your device creates what are called temporary exposure keys that it then stores for 14 days. And if you submit a positive, if you are tested positive for COVID and you submit that you have been tested positive for COVID, then it will send those keys. The devices that receive those keys can then do some math on the keys, the temporary key or the random keys that they've been exposed to, and figure out if one of those keys matches. So it's all math. There's no personal data involved in any of it, and it can't even link it back to an individual device. So it's very privacy minded.
Yeah, I think the one thing that I add to what Brian and Matt have said is, as we implemented this tool, and again, y'all can add to this, we had to implement a public key infrastructure to make the app actually work as we were moving data around so that it was encrypted. We had to use one-way hashes as part of the verification process coming from 2 different points. And so again, really all the way back in April, at the beginning of this project, privacy has been one of those principal design issues that we've tried to incorporate into everything. We've really tried from the beginning. We don't know where you are. We just know you're somewhere on the planet because there isn't cellular service in space. So we know you're on the planet. That's it. And the same is true. I think there was a question that came in. The Bluetooth has to be turned on, but we use low energy Bluetooth. It has negligible effect on battery as that is happening. So again, that's that user convenience component of trying to think about user convenience and privacy so that this works. And I think the last bit is Matt was talking about a positive notification. When that positive notification occurs and you're willing to share that, you make that choice. It doesn't automatically do it. The user is always in control as to whether that is shared or not. And so again, it was built so that the user is in charge. It's private data. It's not being shared. You can't be identified. And that it's just turn it on and let it run and it will work.
Yeah, set it and forget it is really the key benefit to the way that the GuideSafe app works. That it's not something that you have to engage with on a daily basis. You don't have to remember to continue to check it. It's just something that runs in the background and keeps you safe. So another one of the questions that I think is probably forefront in a lot of people's minds is, how is GuideSafe verifying that when somebody reports that they've been positively diagnosed with COVID-19, that they're telling the truth? So what processes are in place in GuideSafe to ensure that?
Yeah, we could actually talk about that for a while. We've been presenting to CDC, MIT, several other organizations on how Alabama solved that problem. Our solution is relatively unique. There are a couple of other countries in the world that are attempting to do it now. But the standard method that Google introduced after we invented ours was for a portal to be set up, an individual to be required to call the Department of Health and either relay a code that the app generated or receive a code from the Department of Health to type into the app. Our Department of Health said, we love what you're doing here. We just don't have the resources and bandwidth to set that up for you. So we had to create an automated method that pulls a lot from the industry standard two-factor authentication methods. So a lot of cybersecurity modeling went into this design, but it's pretty simple. When you want to report a positive test, you go into the app, you type in your phone number, you receive an SMS with a code that you can click on, auto-populates, and it submits the test. There are a lot of cryptographic methods used in the process here, and we do take your phone number for a second. It is disposed of while those keys are stored on our server. A cryptographically sound method of doing that verification on the Department of Health side, where they're collecting your tests statewide. They also collect the mobile number, which is what is used to generate a hash, which is then encrypted. And those hashes are compared to the hashes that we create. Now, I know this is pretty technical, but these hashes that we create on our side to see if we have a match. So at that verification point, other states are having to have a conversation, identify the user by name or by social security number or other methods that are pretty much more intrusive to privacy. So we introduced this method as a primary reason to reduce the burden on our Department of Health, but it is also more secure, more convenient for the user, and it works. So it was a pretty good idea UAB had there. And a lot of other folks are having conversations around implementing it worldwide now.
I will add to that.
Great.
I will add to that real quick. So because they dispose of the numbers and it's a hash is a one-way encryption. So you can never get the phone number back from that. So just on the security side of things, for anybody who's not familiar with hashes, that's a privacy detail there for you.
Wonderful. So I've got one last prepared question for you guys, and then we'll open it up to audience for any questions. So you all start thinking, what are your questions? What do you want to ask that we haven't addressed yet? And that comes down to analytics. So most app owners or people who at least are familiar with somebody who has an app, it's all about, well, what data can you collect? And that comes down to the question of, well, what data is GuideSafe actually collecting?
Emily, I think I can give part of that. So from our perspective, the massive amount of data that we know is we know how many people downloaded the app. Woohoo! So that's an important number.
It is.
And we want that number to be like 5 million. And we're not there yet. We're at 65,000. So hopefully the folks that are on the call will help us get this out there and downloaded. The second number that we know is we can tell anonymously how many positive cases occurred. So we know that there were 137, I think that's the right number as of yesterday, positive cases that were reported through the app. And we don't know who you are. We don't know where it occurred in the world. We just know that the verification process that Brian just talked about correctly worked 137 times. The third piece is we know how many of those 137, how many key exchanges matched with that. And it's not deduplicated data, so you will have copies in there. And that number is somewhere around, I think, 13,000 was the last we saw. So that they're at a maximum 13,000 people have been identified. It's a number smaller than that because we don't deduplicate that. I don't know, I'll defer to the rest of the panel, but I know those are the three keys or three analytic pieces we're paying attention to. I don't know that we have anything else. We don't know your username or password, so we don't know anything about you. We just know who download. We know the number of downloads. We know the number of positive cases where the verification system worked, and we know how many notifications went out based on that.
Yeah, all of those numbers are great. And what I really like about those particular data sets is that it's tracking the effectiveness of the app. It's not actually measuring user behavior. And so it allows Alabama and UAB to have some really great numbers around, we know that this many people have adopted the app, this is how they're using it, but we don't actually have any data around this is who is using it or how they're using it. And it makes it really impactful as a platform that people can trust. And like Curt mentioned, our hope from today's session is that all of you who are listening to this and gathering all of the information, that you all can really become advocates in your own community to say, I know enough about how this app works. I know that it keeps people safe. I know that it protects their privacy. And I want my friends and family to have this app on their own devices, is really the way that we get to the 5 million people in Alabama that have this app on their phone. We're never going to be able to reach everybody through an ad campaign or anything like that. It's going to rely on you all trusting the app and saying, yes, I believe in this and I want the people that I care about to be safe and I want them to have this app to do that. And so with that said, I know that we are at 12:47, time check. I will go ahead and open it up to the audience. And what kind of questions do you still have about how is GuideSafe working? How is it protecting you? You've got the experts in the state on how this thing works. And so take advantage of having them here. What kind of questions can we answer? And if I have to make up questions on the spot, I will.
So I just opened it up. So we did do a couple of polls as you were just doing that wrap up. And so the first poll was how many people, we asked the audience, how many have downloaded a contact tracing app yet? And 76% of our audience have downloaded this a tracing app, and only 24% have not. So that is pretty encouraging. And then our second poll, we asked, just out of curiosity, how many people have come in contact who has been diagnosed with COVID-19? 32% of our audience have responded yes, that they have come in contact with someone who tested positive. 26% stated no, and 42% say they don't know. So
and that's why you need GuideSafe, because you don't know.
Exactly. So just, I guess, having that frame of peace of mind, to know that maybe because like as you're passing someone in the grocery store, could this person have it, and not practicing.
I'm not going to get their names and numbers.
No, exactly. Let's see. We do have some additional questions. So Morgan McIntyre asks, what advancements can we expect on the GuideSafe application in future updates?
Excellent question. What is still ahead for GuideSafe?
Ryan, why don't you answer that in terms of what our partnerships with CDC and National Repository are at this point?
Absolutely. There's two key ones. We've been working with PathCheck, which is a spinoff from MIT, and they're developing apps for multiple jurisdictions. We've been working with APHL, the national labs, who are working on or have developed a nationwide repository. And some of the key features that we're working towards and are certainly interested in developing worldwide are to have a way to share keys across the nation. Right now, Alabama maintains its repository of keys, as does South Carolina or North Carolina, or so forth. So our goal, working through APHL, would be to create one repository where we can share these keys. So if someone from Alabama is exposed to someone from North Carolina, then those key exchanges can happen. And we're well down the road of getting that implemented. Google and Apple are certainly in support of making that happen as well. Because of some of our uniqueness in the way we've done our verification, it's not boilerplate, but we do have the endorsement and support there. The conversations we've been having with PathCheck have been around how, once you've received an exposure, well, how actionable is that information? We've had several conversations with individuals who've engaged with us that I got an exposure, I work in healthcare, you're telling me to quarantine and I can't do that. So what about me? So the general advice that's provided to the public doesn't work for everybody, and it doesn't work in all scenarios. So devising a method that you can privately determine what's the right answer for you on when to use the app, when to what to do when you get an exposure. Those are conversations we're having with some of these nationwide leaders as well, and have been really crucial to discuss inside of UAB. We have 18,000 employees that work in healthcare, and that statewide advice doesn't necessarily resonate in all those cases. So those are some of the key things we've been putting a lot of energy into making sure that there's clarity in every word that we use. Because whenever someone reads it, they can interpret 1,000 different ways. So how does the message come across in every line of text, not just line of code in the app? And that's been a little bit more energy consuming than anybody would want to see. But as an app developer, it shouldn't be that surprising.
You know, the only other thing that I would say, because Brian captured all the future developments, we actually had a patch last week, Wednesday, I think, that we pushed out. But, you know, with the SEC starting football this upcoming weekend, I know that there are UAB and Auburn and Alabama fans that want to die at their respective football stadiums. We just don't want them to. But if you want football to come back and you want full stadiums, then you want to have this app installed by everyone who's attending, and you want that app to work across state boundaries. The SEC, despite popular belief, is not an Alabama-only thing. There are other states in the SEC, and we want them to come visit so that we can watch them lose. And the only way that's going to happen is if we have a national repository and we have the ability to integrate into that. And more importantly, we take workload off of the public health institution or agencies via this verification process so that it's not manual, because it's a lot faster and it is a lot more accurate actually in terms of, and then that flattens the curve and allows us to beat this virus.
Yeah, that's so great.
So we received a couple more questions. The first one, I think, touches on what Curt, you were saying about the patch. So we want to know about, please tell us about the QA testing that was performed on this app.
So I'm going to again point back to the MotionMobs and Brian talk about, we had thousands of students involved with this, but I'll let y'all describe it.
Yeah, just to jump in really quickly, I certainly don't want to suck all the oxygen out of the room, but there were 3 levels of initial testing that we went through. The last one being a 200,000 user open pilot to all of the .edu accounts in the state. And of course, we went through several different levels of rigor in each of those scenarios. Google, Apple, they have a fairly contained device set. tested across the handful of devices they had, but Google tested across every device you get your hands on. So we have hundreds of different device types that they volunteered to test for us from a usability standpoint, a security standpoint, and functionality. They also had volunteered resources for user experience review. So this has been one of the most rigorously tested applications that I've personally been involved in dealing with. And one of the other advantages that we had is because the game framework is standardized, we got benefit from research that Germany and Switzerland and Arizona and all these other jurisdictions have been focused on specific aspects, like what's the perfect tuning for attenuation, or what's the perfect messaging to provide here. So we came together with those organizations. The CDC pulled together an organization to kind of talk through these and benefited from the research that each others have done as well. So it wasn't just us, there was a lot of people contributing to the success of this.
Yeah, I think to kind of finish off our questions, what I would ask the panelists for one last reflection on is, what role did collaboration across the state, across the country, and across the world play in the development of GuideSafe?
Yeah, so I'll take that on. As Brian just intimated, it was widespread collaboration. We were bringing in the medical community. We were bringing in some medical doctors, healthcare doctors, technologists, marketing folks, professors, students were all involved in this. And that's just at UAB and in Birmingham. Across the world, the same thing. As Brian said, we were downloading and reading the papers that other countries were publishing, and we were collaborating with other states as we were looking at where we were, how we were doing things, what were good ideas, what were bad ideas. And I mentioned, Emily, when we kicked this off, one of the coolest meetings is where we're in this kind of scrum with all these medical doctors, and we're trying to work out, well, is it 6 feet or is it 8 feet? Is it 15 minutes? Is it 20 minutes? What's the right attenuation setting? Because that's going to be in dBs. What can we detect? What can't we detect? We said the battery load is negligible. Well, how negligible? All of those things we had to kind of chase down and try to make sure that we were doing it. So it was a vastly collaborative process where everybody was getting together, working, and trying to solve the problem. And I think it's just one of those things that UAB in Birmingham and clearly MotionMobs does well. This idea of creating voices for folks to participate in the project, and so that the best ideas rise to the top, and then those ideas are quickly codified into this. So it's multiple disciplines, multiple teams, all focused on saving lives. And we're reaching out now to the Tech Birmingham community to join that team and help promote this app so we can save lives.
Said very well. Matt, Taylor, Brian, anything else you want to add?
Open source played a pretty big role in our collaboration. A lot of the other countries and states were good about putting their code out there for review. A lot of those weren't using GAIN, but it helped us to learn why GAIN was the better choice. So even though we reviewed a lot of code, a lot of different projects, learned from every one of them, honestly. Some of them, it was, what we did want to do, and some of them was what we didn't want to do. So, we started this project back when GAIN was still just talked about. It hadn't been, barely any documentation had been released at all. So, we started researching immediately and started, and thankfully a lot of the areas had open sourced what they were working on. And so we got to learn from all of that and make this GuideSafe app that much better because of it.
I'll also add that, for as much collaboration as we experienced going to the process of releasing the app, just working with, UAB and seeing the other teams working around the world. After that, we've also had so many opportunities to participate with other teams now catching up and now working on their own solutions and working for other countries and working on, all the different ways that this technology is being pushed and hopefully helping people. And that has been almost greater, even greater. And it's been great to be able to participate as one of the teams that's been out front on this the whole way through, and have not just our opinions and our sort of experiences, but also learn from the teams that are just now coming on and have different opinions and experiences as well. So we're all working as hard as we can to try and stop this thing and help it. It would be great to get to the point where this technology was no longer useful. And that's kind of an interesting problem to have as a developer.
Or at least only useful for the flu or whatever seasonal things, or, for something else.
Not a global pandemic, preferably. Right. Well, thank you so much to all of our panelists, Curt, Brian, Matt, Taylor. We deeply appreciate your time chatting with us today and sharing the information about kind of what's going on under the hood of GuideSafe, and hopefully creating some advocates in the attendees here. So without further ado, Dion, I will hand it back over to you.
Fantastic. Thank you, Emily. Again, UAB MotionMobs, really thank you all for the work that you have done. I'm just incredibly excited to see Birmingham take a forefront, a leadership role in helping the world navigate this global pandemic. And so I think it bodes well from a public safety standpoint, and also just from a future of Birmingham standpoint. So thank you all for bringing this to the Tech Birmingham community. We will make sure that we disseminate this out to reach as many people as we can, whether they were able to join us today or not. And again, for those who will be maybe reviewing this a little bit later, that YouTube channel where you can watch the video is youtube.com/techbirmingham. And if you want to find out more about membership, join us on the website at techbirmingham.com. I believe that is all that we have now. Make sure that you are a subscriber and that you are also checking out the events calendar. We have a lot of things coming up, some this week, then of course some next. So we look forward to seeing you there. Take care. Download the app, guidesafe.org. You'll get all your questions answered there. Have a great day, and we'll see you all later.